to CAN TV broadcast Social Security. I'm Niana. I am with the Chicago Northwest Social Security Office, and I'm here with Victoria. Victoria, tell us a little about yourself.
Hello, my name again is Victoria Farini, and I am with the North Riverside Field Office in North Riverside, Illinois.
And today we'll be talking about the My Social Security, as well as online services for Social Security and Medicare. The Social Security website is a valuable resource of information about all of Social Security programs and is accessible from a computer, tablet, and smartphone. We encourage you to use our online retirement planning tools to plan for a secure financial future. My Social Security is a convenient and secure site of services designed to put you in control of your personal Social Security information, as well as help you manage your benefits when you are ready. Your account gives you the information you need whenever you want, all without calling or visiting our field office. You can only open a My Social Security account for yourself. You cannot open an account for another person, even if you have his or her written consent. You may be unable to open a My Social Security account if you blocked electronic access to your personal Social Security information, recently moved or changed your name, or placed a freeze on your credit report. Your online My Social Security account provides a variety of information to help you and your family. If you need help setting up your account, we have a 4-minute walkthrough video on our YouTube page. You can visit us at www.socialsecurity.gov. Victoria, what could we do on a My Social Security account?
Oh, that is a wonderful question. There are so many different things to do. First of all, you want to go to www.socialsecurity.gov/online services. And there you can manage your account if you're looking to find future benefits, if you're looking to see if you even qualify for benefits. If you want to file an application online, you can do that also. If you are working and you're thinking about possibly retiring, we have this wonderful retirement calculator online. It will give you your own personal estimates depending on what age you're looking to retire as to how much you are entitled to when you finally decide to stop working. So it is an absolute wonderful service.
I have a question, but what if you wanted to refuse your Social Security number to a private business? Can you do that?
Yes, absolutely. You absolutely can. So, but please be made aware that there are some entities, whether it's a school, a medical facility, that may require your Social Security number, and they may refuse services to you if you do not disclose it. But you do not have to give your Social Security number to anybody.
Okay, and just for an example, you can, if the person is requesting your number, you can refuse services. You don't have to give it. Such as businesses, banks, schools, private agencies are free to request someone's number and use it for any purpose that doesn't violate a federal law. To learn more about your Social Security number, you can visit us at www.socialsecurity.gov/SSN number. Okay, but what about if it's a young person who were eager to get their Social Security card for, say, work or school? How could they do that if they wanted to go online and they couldn't go into a Social Security office? What would they be able to do, and what identification could they use?
Another good question. This reminds me of my daughter because she's 12 and I have no idea what I do with her Social Security card. But you don't necessarily need to have a Social Security card if you're looking for employment if you already know your Social Security number. But if you absolutely just want a Social Security card, again, you need to provide the proper documents that are required, and you also need to fill out an application, and you need to either mail or hand deliver those documents and the application to your local Social Security office.
What identification would they need if they would want to apply online opposed to going into the office?
And again, once you go online, all the documentation, depending on your own personal situation, whether it's for citizenship or residency, proof of birth, all that can be found online.
Okay. So, say if they apply online and they have a driver's license, state ID, or passport, they can do that online, correct?
Correct.
Okay. But if they wanted to come into the office, they could use other identification, correct?
Yes.
Okay. So, such as if you're 17, you can use a certified medical record. You can also use an official transcript or a health insurance card if it has the name and date of birth as well as issue date on there.
Absolutely.
Okay. And how could someone keep track of their earnings? How would they be able to do that if they can't
Yes.
go into the office?
Again, this is where it is so beneficial to have a My Social Security account. If you go to www.socialsecurity.gov/myaccount, there you can have control over your own personal information and also conduct business with Social Security. So if you are looking to change your address, if you're looking to change your direct deposit information or add a direct deposit information, if you're looking to get a benefit statement of your earnings, if you're looking to keep up with your earnings from year to year, if you need a 1099, if you need a replacement Social Security card, if you need a replacement Medicare card, all of those things you can do online with your My Social Security account.
So the My Social Security account, I see, is a really good tool to
It is awesome.
create your profile, to see your earnings throughout the year, as well as replace your Social Security card for Illinois residents. That's awesome.
Yeah, it absolutely is, because again, that gives you your own personal control over your information, especially with identity theft being so prevalent as it is now.
Yep. So we're going to switch it up and go on to Medicare.
Okay.
Medicare is our country's health insurance program for people age 65 or older, people younger than age 65 with certain disabilities or permanent kidney failure or amyotrophic lateral sclerosis can also qualify for Medicare. Part A is hospital insurance, which covers most inpatient hospital expenses. The 2017 deductible for Part A is $1,316, and that's for and for Part B is medical insurance, which covers 80% of doctor bills and other outpatient medical expenses. After your first $183 in approved charges, the 2016 standard monthly premium is $134. There is no monthly premium for Part A if you are insured for retirement benefits. After you retire, your health insurance may require for Medicare to pay first. Many supplemental plans require you to sign up for Medicare Part B. The Medicare premium most beneficiaries pay represent 1/4 of the actual cost, and the federal government covers the balance of the cost. Part C involves the Medicare Advantage plans, which are health plans options offered by Medicare-approved private insurance companies. When you join a Medicare Advantage plan, you can get the benefits and services covered under Part A, Part B, and in most plans, Part D. Part D is Medicare prescription drug coverage, which covers a major portion of your prescription drug costs. Your out-of-pocket costs, monthly premiums, annual deductible, and prescription copayments will vary plan by plan. You enroll with a Medicare-approved prescription drug provider, not by contacting Social Security. Each Medicare Advantage plan can charge different out-of-pocket costs, but they must follow rules established by Medicare. A Medicare-approved prescription drug plan covers a major portion of your prescription drug costs. Remember that although the full retirement age has increased above age 65, Medicare eligibility is still age 65. One of the most important things to remember is that you can apply for Medicare online. even if you are waiting past age 65 to apply for Social Security retirement benefits. You should apply for Medicare 3 months before your 65th birthday, even when you plan to apply for your retirement or spouse's benefits later. If you are approved for Social Security disability benefits, you will be eligible for Medicare benefits 24 months from the month you were entitled to receive benefits, not from the first month you receive a payment. According to the law, if you have Lou Gehrig's disease, or if you have permanent kidney failure and you receive maintenance, dialysis, or a kidney transplant, you become entitled for Medicare beginning with the month you first become entitled to disability benefits. Medicare has 3 enrollment periods. Initial enrollment period. Your initial enrollment period has a 7-month enrollment period. It begins 3 months before your 65th birthday, includes the month you turn 65, and ends 3 months after that birthday. Special enrollment period. If you are age 65 or older, you or your spouse are still working and you are covered under a group health plan based on that current employment, you may not need to apply for your Medicare medical insurance, Part B, at age 65. You may qualify for a special enrollment period, also known as SEP, that will let you sign up for Medicare Part B at the time you retire. General enrollment period. If you didn't sign up for Part A and or Part B, for which you must pay premiums, when you were first eligible and you aren't eligible for a special enrollment period, you can sign up during the general enrollment period between January 1st through March 31st each year. You may have to pay a late enrollment penalty for as long as you have Part B coverage. This chart shows when your Medicare will become effective if you apply during your initial enrollment period. If you apply during the 3-month window prior to the month you turn 65, your Medicare kicks in the first day of the month you reach age 65. This graphic shows the Medicare premiums for each income bracket. Irma, if you're in a higher income household, you may be subject to income-related monthly adjustment amount. Please keep in mind that although you apply for Medicare by contacting Social Security, we have some Medicare information on our website. It is actually another federal government agency, Centers for Medicare and Medicaid Services, commonly referred to as CMS, that administers the program. CMS is your main source for information regarding Medicare. Social Security helps you apply for Medicare Parts A and B, and we send your application information electronically to CMS. We can also take your application for extra help with Medicare Part D. If you sign up for Part D, we deduct the premium from your monthly Social Security benefit and send it to CMS before you receive your monthly payment for us each month. If you enroll in Medicare only, CMS will bill you for Part B premiums until you go on your Social Security benefit. If you have any questions regarding the Medicare program, you can call CMS at 1-800-MEDICARE or visit medicare.gov. You can also contact your local Medicare office or Senior Health Insurance Information Program. So, Victoria, say I'm age 65 and not yet ready to retire, but I want Medicare coverage. What should I do?
Another good question. You can go online. Again, this is another reason why our online services are just so wonderful. It is a very quick and easy application. It takes less than 10 minutes to go online and file for your Medicare Part A. If there are any additional documentation, Social Security will call you, but otherwise, we will process your application and your Medicare card will be sent to you shortly after.
Okay, one other question. Say I'm already receiving benefits and I am receiving Medicare, but I lost my Medicare card and I need to show proof to my medical examiner that I have Medicare. How can I do that?
So again, this is where you can also go online to your My Social Security account, and you can print out a statement that does show that you do have Medicare benefits.
That is so good because we have people, all the time coming in saying, "Oh, I misplaced my Medicare card," or
Yes.
"I need proof because I need to see my doctor." And Medicare, so it's easy. Just create your online profile. You can request your Medicare card. You can also request a verification to
Absolutely,
take.
absolutely. And as I'm sure so many people have unfortunately experienced, there are a lot of our field offices. You come in, no matter whether it's first thing in the morning, in the afternoon, when it's almost time to close, and there is a line. And you have to sit and you have to wait, and you feel your whole life slowly going by until they call that ticket number. So going online to create your own account, utilizing our online services is just such a wonderful, time-effective way for you to do so many different things from the comfort of your home or on your iPhone if you have internet access on your smartphone. It just makes things just so much more convenient for you.
Yes. Well, we appreciate you all visiting us, watching the broadcast. I hope you all took something from here, which is online services, creating your profile, making sure you are enrolled into Medicare, especially if you're age 65. You want to make sure you get enrolled into the Medicare services, or if you're planning on retiring, make sure you re-enroll into the Part B before you get any penalties. Thank you for joining us.
Have a wonderful rest of your evening.